Well, tonight we start our series Understanding Autism. 1 out of every 100 kids in Arizona is diagnosed with autism, and according to the CDC, almost all of them showed signs before age 3.
But less than a third of those kids get evaluated, and some can miss the key step of early intervention. 9 News Side's Taja Davis breaks down how the screening process works and what the diagnosis means for parents.
Depending on the severity of symptoms, local psychologist Dr. Christian Thompson says most parents may start to notice less typical behavior in their child between the ages of 1 or 2. She says at least 90% of parents have reported noticing symptoms before age 3.
The earliest right now that we can reliably assess and diagnose autism is starting around age 2. However, for kids with more mild symptoms of autism, oftentimes we can't confidently diagnose autism until they're in a school setting and they're needing social skills, and suddenly we can see that their social and communication skills are behind where they should be.
And she says it's hard to state a specific age when a child can be considered to be in the clear of having autism.
That being said, if a kid was engaging with others, trying to play, interested in socializing and playing with other kids by the time they're in preschool or about age 3, it would be extremely unlikely that they would end up with a diagnosis of autism.
The screening and diagnosing process for autism is quite different from other medical tests. The process happens over a few different appointments over the course of a few weeks. Here are the steps. Psychologists meet with parents to get information on the child's behaviors, medical and developmental history. Psychologists will then try to obtain records from medical providers the child has already seen, like a speech therapist. Now, if the child is in school, the psychologist will also talk with teachers about their learning and social habits. The formal testing usually comes after gathering all of that data. It's a one-on-one session where factors like IQ, communication skills, and play are measured more objectively.
And then when it's all done, all that information is taken together and we can say, yes, the difficulties they're having are due to autism, or no, they're due to something else.
Once that diagnosis comes back as the child having autism, the next phase is breaking the news to the parents.
Honestly, I think the most common reaction I get is relief. Usually by the time a parent has sought out getting an evaluation and having their child tested for autism, they've had sometimes years of dealing with behavior problems and social problems and learning issues and not knowing why. So they've tried lots and lots of things and nothing's worked.
She says that the diagnosis can make the parents feel better because they finally know the issues their child has is not due to bad parenting or simply because their child is behaving poorly. The child is struggling because they have autism.
And then now that we know they have autism, we can direct them of what are the best interventions and where to go.
Now having a treatment plan families can move forward with. Taja Davis, KGUN 9 on your side.